My name is Kate Fisch. I'm the Associate Vice President of Clinical Services for the Odyssey Eating Disorder Network. ERPT stands for Exposure and Response Prevention Therapy. So the "and" in there is important, right? We're looking at the exposure to a stimuli and a person's response. The assumption is that the response is not appropriate, impairing, distressing, and so we want to prevent that response. So an example of how we would use that for someone with an eating disorder would be perhaps an individual who has very negative body image, doesn't want to look in the mirror, see their reflection. Well, in life, we're going to see a reflection. It's going to happen, and so it's a good idea while in treatment to start to decrease the type of distress that comes with the reaction. So an individual might be exposed to their reflection, be exposed to a mirror, and this can be done in varying levels, be exposed to their reflection, elicit the response, the negative response, and do that enough of the times in a very safe, understanding, compassionate environment that their response to the exposure is they're desensitized. So the anxiety that they might experience decreases with the increased frequency of the exposure. So using ERPT for the treatment of eating disorders is typically not something we would just use on its own. Using exposure and response prevention therapy as a supplement or as an add-on to the whole library of evidence-based treatment modalities that we use to treat eating disorders. It is an opportunity really to practice what happens in the real world outside of treatment. We know that our clients are going to encounter things that are distressing for them. We want them to practice to be able to decrease their own response, their own distress on their own, so that they don't go out, leave treatment, graduate from treatment, and are met with stressors that might lead them to relapse and need to return to treatment.